Today, we'll be discussing heart failure, focusing on a high-yield overview of this clinical syndrome. Heart failure is a clinical syndrome where the heart is unable to pump sufficient blood to meet the body's metabolic needs, or can only do so by increasing filling pressures. This leads to symptoms caused by both a reduced forward flow of blood and congestion. Understanding this definition is crucial because it highlights that heart failure is not just about a weak heart muscle, but also about how the heart's pumping efficiency affects the entire body. The key point here is that the symptoms arise from these two main issues: inadequate blood flow and fluid buildup in the body. Here, we focus on understanding heart failure by looking at its diagnosis, symptoms, and key findings. One of the classic symptoms is peripheral edema, which is swelling caused by fluid retention, typically becoming worse with activity. This usually leads to ankle swelling. Patients often experience orthopnea, which is worsening breathlessness when lying flat, caused by increased pressures in the heart. Finally, breathlessness itself reflects fluid overload and a reduced cardiac reserve, meaning the heart struggles to meet the body's demands. These three symptoms together form the classic presentation we need to recognize. When examining heart failure, there are several key signs we need to focus on. Peripheral edema, or swelling in the ankles and legs, is one of the main symptoms, reflecting fluid retention linked to heart failure. Another critical indicator is raised jugular venous pressure, which signals congestion and elevated central venous pressure. Together, these signs form the foundation of clinical diagnosis and help us understand the severity of the condition. When diagnosing heart failure, auscultation is a crucial step. You may hear fine bibasal crackles and an S3 gallop, which are important indicators of heart failure. If the heart failure is due to valvular heart disease, listen carefully for specific murmurs like aortic stenosis, mitral regurgitation, or aortic regurgitation. Heart failure diagnosis relies on a combination of clinical evaluation and diagnostic tests. Echocardiography plays a crucial role by providing detailed images to assess heart function and structure, helping confirm the presence of heart failure. Additionally, the BNP blood test is an excellent initial tool because it detects elevated levels of B-type natriuretic peptide, which indicate cardiac stress. However, echocardiography remains a preferred option for confirming the diagnosis. Thank you for your attention. Please like, subscribe, and share the medical briefs.